inequalities and become yet another reason some people are left behind. We shouldn't leave anyone behind. This is true between countries and within countries. The task of narrowing inequalities does not start after the pandemic. It must be part and parcel of the response. If the world fails this test, what hope is there of living up to the scope and scale of the Sustainable Development Goals? In April, with support from many partners, WHO established the Access to COVID-19 Tools Accelerator. This is a completely unprecedented partnership with two aims: to develop vaccines, diagnostics, and therapeutics fast, and allocate and deliver them fairly. Already the ACT Accelerator has delivered real results. We have reached agreement for the purchase of 120 million low-cost rapid diagnostic tests for low and middle-income countries. We have secured supplies of dexamethasone, the only medicine shown to reduce the risk of death from COVID-19, for up to 4.5 million patients in lower-income countries. And as part of the ACT Accelerator, 189 countries and economies are participating in the COVAX facility. But unless the ACT Accelerator is fully funded, it is in danger of becoming no more than a noble gesture. The ACT Accelerator faces an immediate funding gap of $4.3 billion to lay the groundwork for the mass procurement and delivery of vaccines, diagnostics, and therapeutics. A further $23.9 billion will be needed next year. Let me put that in perspective. That is less than half of 1% of the $11 trillion of stimulus packages announced by G20 countries so far. Vaccines are an investment that will be repaid rapidly and many times over. Sharing the fruits of science is not charity. It is in the best of interest of every nation. Second, investment in preparedness to prevent the next pandemic. Despite years of warnings, many countries were simply not ready for COVID-19. Many mistakenly assumed their strong health systems would protect them. Many of the countries that have done best are those with recent experience of responding to outbreaks of SARS, MERS, H1N1, and other infectious diseases. Now, all countries must develop that same muscle memory and invest in the measures that will predict, prevent, control, and mitigate the next crisis. It's also clear that the global system for preparedness needs attention. The international health regulations is a powerful legal tool, but countries must use it more effectively. It's clear that the IHR can only be successful if it's based on mutual trust, mutual accountability, mutual transparency, and robust political legitimacy. In September, I established a committee to review the functioning of the international health regulations during the pandemic and to provide recommendations on how to strengthen its implementation, including the binary mechanism for declaring a public health emergency of international concern. WHO is also engaging with several countries on developing and piloting a new mechanism, the Universal Health and Preparedness Review, in which countries agree to a regular and transparent process of peer review, similar to the Universal Periodic Review used by the Human Rights Council. In addition, we welcome the initiative proposed by the President of the European Council, my friend Charles Michel, for an international treaty to provide the political underpinning for strengthening the implementation of the international health regulations and global health security. Thank you so much, President Michel. The pandemic has also shown that there is an urgent need for a global agreed system for sharing pathogen materials and clinical samples to facilitate the rapid development of medical countermeasures as global public goods. Switzerland has generously offered the use of a high security lab at which WHO would manage a new biobank, and we are now developing the framework under which samples would be provided and shared. And I would like to use this opportunity to thank Thailand and Italy for becoming the first two volunteers to deposit their pathogens in the bank. And I thank Switzerland for allowing us to use its labs as biobank. Third, invest in health at the foundation of peace and prosperity. The pandemic has proven that a health crisis is not just a health crisis. It's a social, economic, political, and humanitarian crisis. Millions of people have lost their livelihoods. The global economy has been plunged into its sharpest downturn since the Great Depression. Geopolitical fissures have widened, and the multilateral system has been called into question. The risks of underinvestment in health have wide-ranging impacts, and so do the benefits of investing in health. My sister Amina, you have described health as the docking station for all of the Sustainable Development Goals. Thank you, and I couldn't agree more. Health is an investment in successful societies. It enables individuals, families, communities, and nations to flourish. The world spends $7.5 trillion on health every year, almost 10% of global GDP. But most of this spending is in the richest countries and is disproportionately directed to treating disease rather than promoting and protecting health. We need a radical rethink of the way we view and value health. It's time to do this. Accordingly, I have established a new council on the economics of health for all to examine and elucidate the links between health and inclusive innovation-led economic growth. The council will be chaired by the distinguished economist, Professor Mariana Mazzucato, and Her Excellency Sanna Marin, the Prime Minister of Finland, has generously agreed to be its patron. Kiitos, Madam Prime Minister. The good news is that there is already strong political commitment for health. At last year's General Assembly, all UN member states converged to endorse the high-level political declaration on universal health coverage. You embraced a vision for a world in which all people have access to essential health services without facing financial leadership. The pandemic has only underlined why universal health coverage is so important. In the face of the pandemic, many countries have offered free testing and treatment for COVID-19 and have promised free vaccination for their populations. They have recognized that the ability to pay should not be the difference between sickness and health, between life and death. Shouldn't that also be true for a crisis like cancer, heart disease, HIV, TB, or malaria? Shouldn't it also be true for services like routine immunization, maternal care, and tobacco control, which can prevent a crisis and the costs of dealing with it? Universal health coverage is built on strong health systems. Many of the countries hit hardest by COVID-19 are those with highly medicalized health systems, with access to the world's most advanced drugs, devices, and specialists. Those things have great value, but too many countries have neglected investments in basic public health functions that need very small, low investment, but which are the bedrock of safe and healthy nations. In particular, strong primary health care is the eyes and ears of every health system and is essential for preventing and responding to emergencies of all kinds, from the personal crisis of a heart attack to an outbreak of a new deadly virus like this one. If the world is to avoid another crisis on this scale, investments in basic public health functions, and especially primary health care, are essential. And all roads should lead to universal health coverage with a strong foundation of primary health care. And fourth, investment in multilateralism to safeguard our common future. A vaccine will help to end the pandemic, but it will not address the vulnerabilities that lie at its root. There is no vaccine for poverty, no vaccine for hunger, there is no vaccine for inequality, there is no vaccine for climate change. Once the pandemic ends, we will be left with even greater challenges than before it started. In 2015, the nations of the world adopted the Sustainable Development Goals with their sweeping vision for people, planet, prosperity, peace, and partnership. The same year, nations adopted the Paris Agreement and the Addis Ababa Action Agenda on Finance for Development, which I had the honor to chair. The world converged around a common vision for the future. But in the years since, we have witnessed a dangerous divergence. The Paris Agreement has been undermined. The commitments made in the Addis Ababa Action Agenda have gone largely unfulfilled. And although there has been progress toward the SDGs, too often our efforts have remained siloed and splintered. Together, we must once again choose convergence, choose collaboration, choose cooperation, choose solidarity. Convergence is a choice. We did that in 2015. Together, we must heed the Secretary General's clarion call for a decade of action to pursue the SDGs with even more innovation and determination. Thank you, Secretary General. Last year, WHO and 11 other multilateral agencies came together to launch the Global Action Plan on Healthy Lives and Well-being for All, to support countries to accelerate towards the health-related SDG targets. The type of collaboration between partners and between countries must be the hallmark of the post-pandemic era. Together, we have shown that in the face of a global crisis, the world can come together in new ways to solve urgent problems. And together, we must harness that same urgency and innovation to address the full range of challenges we face. No one else will do it, and it cannot wait. It must be us, and it must be now. Humanity has overcome many plagues and pandemics before, and we will overcome this one. We will overcome this one. But we cannot, and we must not, go back to the same exploitative patterns of production and consumption, the same disregard for the planet that sustains all life, the same cycle of panic and neglect, and the same divisive politics that fueled this pandemic. The pandemic has brought us to a fork in the road. Behind us lies the path of business as usual, the path that led us to this crisis. Lies a new path, a path on which nations do not see themselves as rivals in a zero-sum game, but as fellows, travelers with the same aspirations, hopes, and dreams. We're fellow travelers with same aspirations, hopes, and dreams. A vision that affirms our common history and our common future. That recognizes we're richer for our diversity and that we are more than the sum of our parts. Our diversity is our beauty and even our strength. 75 years after its birth, the United Nations remains more relevant than ever and more essential than ever. WHO is proud to be part of the UN family, and we remain committed to working with all countries to ensure the United Nations lives up to its name and aspirations. I thank you. Tashakure, Mr. President.
I thank the Director General of the World Health Organization for his statement. As indicated in the program, this informal meeting also consists of 3 interactive panels to be held in